Welcome to my YouTube channel. Before I proceed, I would like to thank my subscribers. You people are really amazing for supporting my channel. I really appreciate you all. Thumbs up to you guys. So in today's video, I'll be discussing about the different types of vaginal discharge. The ones that are normal and the ones that are abnormal. So that once you see a deviation from the normal, you would be able to detect that this thing is abnormal and it needs urgent attention. So after this video, you will really understand the difference between a normal vaginal discharge and an abnormal vaginal discharge. And if today is your first time of watching my video, I'm Cherechi, a fertility nurse and a staff nurse midwife. And my channel focuses on women's reproductive health and fertility. And if this is the kind of content you like watching, please subscribe to my channel. So let's get started. What is this vaginal discharge? It is a fluid that helps to keep the vagina clean and protect it against infection. Without this vaginal discharge, the vagina is likely to be infected. So we have different types of vaginal discharge. Number one, a white and watery vaginal discharge. It is a normal vaginal discharge. When you see this type of discharge that is white and watery, it could be as a result of pregnancy or sexual arousal, especially the watery one. Sexual arousal, maybe when you're having fun with your partner, that could be as a result of that. Then when it comes to pregnancy, that's the type of discharge you will see, although the volume will increase when you are pregnant. All these are to protect you, the vagina, against infection. Then we have the thin, clear, stretchy and slippery vaginal discharge, like raw egg whites. This shows that you are about to ovulate. And the texture of this discharge makes it easier for the sperm to swim fast to go and fertilize the released egg. So when you experience this kind of discharge, it is normal, and you should bear in mind, have it at the back of your mind that you are about to ovulate. Then thick and thick vaginal discharge. This type of discharge is normal and it occurs at the end of your period as estrogen begins to build up in preparation for ovulation. So this type of discharge is normal. Again is the brown vaginal discharge. This type of discharge is seen in perimenopausal, at the end of your period, and endometriosis. When you come to perimenopausal, that is transition into menopause. At this stage, you are not menstruating every month. At times, you menstruate like 4 or 5 times in a year, and the estrogen level is now low. And at this period, the linings of the endometrium will be breaking down without being expelled. So any month you are to see your period, those cell tissues that are still in the endometrium will mix with the normal blood to come out as a brown discharge. So during perimenopausal, you experience this type of discharge. It is normal. Then at the end of period, during the end of the period, your period is now slow, and as the speed reduces, there is a possibility that it will oxidize. That is, oxidation will occur, making it to be brown in color. So it is also normal at the end of your period to see brown discharge. When it comes to endometriosis, it also happens that the linings that are supposed to be seen in the endometrium are elsewhere, either the fallopian tubes. But when they are still within the endometrium, they would like to pile up more than the normal endometrial lining. They will be thick, and at a point, the linings will be breaking without being expelled. So any month you are to see your period with those tissues, the old tissues that are there already, it will still come out as a brown discharge. So once you notice this type of discharge and you have this condition, endometriosis, you shouldn't be worried, because that's how it comes when you have this condition, but not in all cases. The next discharge is pink. This discharge, you can see it at the start of your period. Miscarriage, that's early miscarriage. Cervical bleeding, maybe in terms of contact bleeding. When you have sexual intercourse with your partner, you can see this type of discharge. Then implantation bleeding. These are the type of conditions that you are likely to see this type of discharge. We also have the red vaginal discharge. This happens during menstruation, which is normal. For the first 2-3 days of your period, it is always red. So when you have a red vaginal discharge, it could be as a result of your menstruation, miscarriage, also cancer of the reproductive tract, especially the menopausal women. Once you've reached menopause and you start seeing red vaginal discharge, that's not a good sign. You should seek an urgent help from a doctor. Then uterine polyp, it grows in the uterus, especially the endometrium, because this polyp, they will exert pressure, a kind of irritation around the surrounding tissues, thereby making the linings to break and bleeding will occur, and it is a kind of reddish discharge that will come out. Outside menstruation, once you notice any red discharge from your vagina, that's a red flag. You need to seek an urgent attention from your doctor. We have the thick, milky or whitish cheese-like discharge. You see that cheese-like, underline it. Cheese-like discharge. Thick, whitish or milky cheese-like discharge. Once you notice any cheese-like discharge, that shows a thrush. That's yeast infection, candidiasis, which is caused by Candida albicans, and it causes itching. So once you notice this, your mind should be telling you that this is candidiasis, and it's antifungal that you will use to treat this infection. And it is not a sexually transmitted infection. The next one is watery, thin, grayish vaginal discharge. Once you see this type of vaginal discharge, watery, thin, and grayish, this is a sign of bacterial vaginosis. It's a bacterial infection, and it's as a result of imbalance of bacteria in the vagina. It is not a sexually transmitted infection. You need to seek an urgent attention from your physician. And antibiotics is the first line of treatment. At times, it can resolve on its own when you stop those things that can predispose you to that condition. Example, you should stop douching. Vagina is self-cleansing already. The discharges you are having, the normal ones, are to protect the vagina against infection. Then you limit the number of sex partners you have to avoid this bacterial vaginosis. And if left untreated, it can lead to PID, that is pelvic inflammatory disease, as a result of ascending infection from the vagina. It will now go to the uterus, to the fallopian tubes, which might cause blockage, and it will result to infertility. You can even predispose someone to sexually transmitted infection. So once you notice this type of discharge, my sister, it is a red flag. Seek an urgent help from your doctor to avoid the complications. The next type is the one that is clear, white, green, or yellow. That is, it could be white, clear, yellow, or green. That is frothy. That is, it is foamy, and it has a fishy smell. It is very abnormal. Once you notice this type of vaginal discharge, clear or white or green, yellow, with fishy smell and frothy, it means Trichomoniasis, and a parasite called Trichomonas vaginalis causes this type of infection, and it is a sexually transmitted infection. According to some researchers, it is the most common sexually transmitted infection in the USA, and about 30% of people experience symptoms of this, and it affects 3.7 million people, and it's even the most curable sexually transmitted infection. And the first line of treatment is antibiotics. Please, once you notice this sign, it is a red flag. A vaginal discharge that is frothy and has a fishy smell. Your mind should go back to Trichomoniasis. The next type of vaginal discharge is the white, yellow, or gray discharge. White, yellow, or gray with foul smell, a strong smell. Once you start noticing this type of discharge, it shows that you have chlamydia. It is also a sexually transmitted infection which is caused by a gram-negative bacteria, Chlamydia trachomatis. And this is also the most common sexually transmitted infection worldwide. And it affects about 30% of sexually active young women. If left untreated, could also lead to pelvic inflammatory disease, which will eventually lead to infertility. So when you notice this kind of discharge, a discharge that is either whitish, gray, or yellowish in color, that has a foul smell, the smell is so strong, it is this chlamydia. How do you prevent this? Reduce the number of sex partners that you have. It's not a joke for someone to be infected, especially sexually transmitted infections. They are treatable, yes, since it is caused by a bacteria. Antibiotics is the first line of drug, the drug of choice for this. But we need to be careful because of the discomfort, everything that comes with it. Reduce the number of sex partners you have to avoid this kind of infections. The last but not the least is the one that is thick white. It could be thick green or thick yellow. What am I trying to say? Once it is green, yellow, or white, it must be thick and also has a foul smell. When you notice this, it indicates gonorrhea. I said what? When you notice this, it indicates gonorrhea, which is a bacterial infection also caused by Neisseria gonorrhea, and also a sexually transmitted infection. It is less prevalent compared to chlamydia. It affects about 0.8% sexually active young women, and it is common in women than men. With this gonorrhea, when left untreated, can as well lead to pelvic inflammatory disease, and on the long run can also lead to infertility once there is a blockage both in male and in female. When it comes to the male, it occurs along the epididymis, while in female, the fallopian tubes. So once you notice this kind of vaginal discharges, please try to contact your physician. In a nutshell, whenever you notice any whitish, yellowish, greenish vaginal discharge that is thick or with these colors, it indicates sexually transmitted infection, and immediate attention is needed, please, to prevent the complication. In summary, if your vaginal discharge doesn't have any strong smell or unpleasant smell. It is thick and thick. It is clear and white. It is slippery and wet. You don't need to worry about anything. It is normal. On the other hand, even if it is thick or stick, but have this pungent smell, fishy smell, green or yellow or gray in color, please, they are abnormal. Try to see your doctor to prevent any complication, because once that complication occurs, it's very hard to treat. Prevention is better than cure. So if you really enjoyed this video and it is informative, don't forget to subscribe to my channel and hit the notification bell.